Hi, my name is Lisa Alattar, and I am a hematologist-oncologist at Oncology Consultants. And I am here today to discuss managing cancer care in the setting of COVID-19 pandemic. First off, we want you to know from the OC family that we are here for you and we are taking certain precautions using the expertise recommendations all over the world to help keep you safe. We can't imagine how scary it is and how challenging it is for our own patients that are not only concerned about the COVID pandemic, but also are worrying about their cancer or history thereof. So first off, I would like to address what has affected a lot of you, which is the surgery delays. Due to limited resources in the hospital setting, ICU beds, staff, and PPE or protective gear for healthcare providers, a lot of the surgical societies, including American Surgical Breast Cancer Society, American College of Surgeons, they have created different recommendations for the surgeons about which cases that are considered more elective and which cases need to be delayed. That may affect a lot of, for instance, my breast cancer patients who, as of March 27th, were maybe scheduled for a breast cancer surgery for curative intent, but unfortunately, due to the new recommendations, they are being delayed. That must be very frightening, and I can't imagine how scary that must feel to have your surgery delayed, also the frustration associated with it. However, for a lot of these patients, there are other options. So for instance, if it is an early stage hormone-positive breast cancer, a group of expertise surgeons all around the world and nation have gotten together and said, can this wait? Well, there is some data to suggest that an early stage hormone-positive breast cancer with a low division rate could actually wait sometimes a couple of months. What could you also do about that? Medical oncologists can provide endocrine therapy, for instance, in that specific case. There's data in the neoadjuvant setting or before surgery setting that you can actually take endocrine therapy and potentially shrink the tumor, and this could be useful despite the delay in your surgery. Now here's a word from a breast surgeon herself, Dr. Liz Lee, to elaborate more on the new recommendations that were provided by American Society of Breast Surgeons.
Hi, my name is Liz Lee. I'm a breast surgeon that works at Southwest Surgical. And it's an honor for me to be here to share with you my heart about your care in light of this COVID-19 pandemic. We understand as your doctors that when you're diagnosed with breast cancer, there's a lot of fear and there's a lot of anxiety. And to compound this with a pandemic where no one knows what tomorrow brings makes that exponentially worse. Unfortunately, we as your doctors are faced with a unique set of challenges when we take care of you that we've never been faced with before, meaning limitations in hospital resources and staffing and protective equipment. And as surgeons, we are under new mandates not to operate on elective surgery. And this is something that is completely new to us also. And in order to address these pressing issues, there has been a consensus, meaning representatives from multiple cancer care organizations consisting of the American Society of Breast Surgeons, the National Accreditation Program for Breast Centers, the National Comprehensive Cancer Care Network, and the American College of Radiology. And these expert representatives have gotten together and categorized patients in terms of acuity of care, meaning category A being patients who need urgent surgery, urgent treatment, category B meaning that these subset of patients cannot wait until the pandemic is over, and category C where patients can be safely treated and to wait until the pandemic is over without any harm to their overall survival. Fortunately, most of the patients that we see fall into category C, meaning that most patients are stage 0 and stage 1 patients who have the estrogen receptors. These patients are responsive to endocrine therapy with no clear detriment to survival if surgery should be delayed until this pandemic is over. With that being said, your oncologist and I are working closely together to make sure that we are taking everything into account, meaning the growth of the cancer, how aggressive it looks, how you're responding to treatment, and we are collaborating to ensure that you get the best care that you can and that your cancer is not progressing in light of everything that is going on. We want to reassure you that your health is of utmost priority for us and that we want to take the best care that we can for you in light of everything, and that we are going to see you through to the end. Thank you.
So at OC, we have made a few changes to try and safeguard your safety in the setting of COVID. Number one, we have transitioned to mostly telemedicine consultations for new and established patients. That helps reduce your exposure and staff's exposure because you don't have to physically be here, but we can still order all your medications and we can still discuss all issues potentially related to your cancer diagnosis or hematologic concerns. Number two, our pharmacy is still up and running, and we have transitioned to almost all oral medications being mailed to you, so we can overnight mail it so that you don't have to physically come in and pick up your medications, also to reduce exposure. Number three, all staff are required at OC to have specific personal protective equipment. We're wearing masks, we have strict hand washing guidelines and trying to minimize your exposure and staff exposure. We are also wiping down frequently on the door handles and inside rooms. We are doing vital signs at the front office for all staff and patients. So before you even enter, we are checking temperatures and making sure that nobody with a fever is left unnoticed. Also, I wanted to mention that a lot of you have questions about clinical trials. Since we are an active clinical trial site, depending on principal investigators, most of our trials are still active and ongoing. I just actually enrolled somebody this past week. But obviously, yes, they have been affected slightly, but for the most part, we're still up and running. Now, if you have any further questions, American Society of Clinical Oncology has a list of great resources, including cancer.net, and they are actively updating resources for COVID-19 in the setting of cancer care. Thank you for your time.